My name's Donna, I'm a Practice Education Facilitator and I'm based in Glasgow. I joined Optical Express in 2004, Valentine's Day actually, and I was a receptionist and optical advisor at one of the stores in Glasgow. It was only laser vision correction we did at the time back in 2004, and it was just such an interesting area. And I sort of just spent as much time as I could really watching surgery, and only worked the weekends, still at school at the time, so worked the weekends, and used to go in and observe really as much as I could, just gain a bit of experience. And I think I finally wore the surgery manager down in about 2006, and then that's why I joined the surgery team. I really loved my job before as an associate, and I think it was just a bit of a natural progression. I always wanted to go back to uni and complete a degree, so nursing was just a bit of a natural progression really. I worked for the NHS for probably about 6 months in ophthalmics and came back. I had a little boy just after I qualified and came back. It gave me a great work-life balance. I really loved my job before, and I kind of always wanted to come back to OE. It was always in the plans. It was probably the people. We work in quite small, close teams. You work quite closely with the surgeons, with the optometrists, so there's always somebody about to learn something from, and a really great support network. The company formed a lead theatre committee, so it was a group of nurses from across the whole company, and they would meet maybe once a quarter. You would discuss current practice, best practice guidelines, things that you'd seen in practice. The discussions we had there were then taken to this clinical governance group, so really you had a really good ability to affect positive change. Lead Theatre Practitioner is basically a senior nurse within the company who work at sort of promoting best practice. They're really heavily involved with junior colleagues in their training and their development. Really just look to make sure best practice has been followed, so infection control and prevention, keep our patients safe by adhering to policy as best we can. Optical Express have helped develop me on the journey by giving nurses external and internal courses quite frequently. Every year Optical Express provide us with an immediate life support course, so our skills are always kept really up to date. Johnson & Johnson come in quite often as well, so the company that provide our phaco machines, they come in and they provide us with theoretical modules as well, just to make sure our knowledge is always really up to date. My current role is that of Practice Education Facilitator. I'm based in Glasgow, but I cover pretty much most of Region 1, so the whole of Scotland, down to Newcastle and across to Ireland. I've been in the role for about 18 months now. And it is absolutely the most diverse role that I've had to date. And this role is my first kind of venture into clinical education of any sort, so Optical Express have been great in supporting that. They've put me through a diploma in clinical education, so that's really helped shape how I do this job. It's a really diverse role. Obviously clinical education is at the heart of it, but it's really a small part of what we do. As a PEF, you're really involved in the creation of competency modules and quality improvement, and in the regulatory side of the business as well. So the role of a theatre nurse at Optical Express is basically being trained to assist the surgeon during IOL and laser vision correction procedures. It can be quite varied. We offer a few different types of procedure, a few different types of treatment, and depending on what we're doing on that day, the role can be quite different. So as a theatre nurse with Optical Express, it doesn't necessarily mean you're going to be in theatre all day. We offer lots of different roles for a theatre nurse. You could be admitting patients on a Monday, discharging them on a Tuesday, you could be in theatre scrubbing on a Wednesday, that type of thing. It's quite a varied week. So professional development for nurses has always been a key area at Optical Express. There's a really clear and concise progression pathway for nurses, and you will be fully supported with whatever route you decide to take, whether it's the clinical education route like I've done or the management route as well. Nurses, when they start with us, are given a very tailored, a very specific training programme, and your background and your experience will help sort of tailor that to your needs. Normally when you start with us, you start as a registered nurse, and we'll train you to admit patients, discharge patients, that kind of thing. There's lots of modules in place where you learn the theory, you then come with us into practice and you put into practice what you learned basically. From there, once you've got that, we look at theatre nursing. So we'll teach you how to scrub, we'll teach you about infection control in theatre, that kind of thing. Once you've done that, you've got a bit of a choice to make, so you can go the education route, as I've said, you can do the lead theatre course and then onto PEF, that kind of side, or you can look to change into management.